Hi, my name is Mona Elkert. I am an outpatient social worker at Hoag, and I work at the Hoag Family Cancer Center. And today we are going to be doing a class on how to manage stress and anxiety for cancer patients. I welcome all of you. So glad that you can join us today. We all live with stress and anxiety on a daily basis. And when you add a serious diagnosis like cancer, that is going to add to your stress. When you add COVID-19, that is also going to add to your stress. So our hope is that today I will be able to give you some tools, identify stress, and give you some tools to manage that stress. And we will end with a very nice meditation, and we'll have 15 minutes left for questions. And I welcome all of you, and I'm very excited to do this presentation for you all. Thank you. Okay, we're going to be, what's going to happen next is the slides are going to go on the screen, and you'll be seeing the slides and hearing my voice. So you won't be seeing me after this until we do questions at the end. So if you have any questions during the presentation, please write them down, remember them, and then you'll be able to submit them, and I will answer your questions. All right, we're going to begin. Okay, so what is stress really? It's a chain reaction. What happens when we're feeling stress is that we have a flight or fight response. And that is what's responsible for our outward physical reactions. Sometimes we get a fast heart rate, our senses get heightened, we need a deeper intake for our oxygen, and then there's a rush of adrenaline. Something called cortisol is released to restore the energy lost in the response. So any of you that have had a very stressful reaction, it can be also called an anxiety attack, is you can get dry mouth. As I said, your heart starts beating really fast. Sometimes when we feel anxiety, it's a visceral feeling, and it's even hard to even label it with any of these observations or behaviors. Okay. We have acute or chronic stress. We all have acute stress, and that is not harmful. Long-term stress lasts weeks, months, or years, and that can weaken our immune system and increase our risk for digestive problems and for depression. So just to keep in mind, we can all think of times where we've had temporary acute stress, and we are usually able to manage that, but it's the chronic stress that tends to be the most difficult and hard to manage. So I mentioned depression in the last slide, and I think that when we're going through a serious illness or have had a serious illness, we sometimes confuse grief and depression. And even after a cancer diagnosis, even as a survivor, there is still a tendency to experience grief. So I want to talk about the differences between grief and depression. When we are diagnosed with a serious diagnosis, there's a lot of grief involved. And when we're going through grief, there is an identifiable loss. When we are depressed, the loss may or may not be identifiable. So you can see the differences here. When we are grieving, the focus is on the loss. And when we are depressed, the focus is on the self. When we're grieving, there is sadness and emptiness. And when we're depressed, there is sadness and emptiness. That is what kind of makes it confusing, because those are both common denominators. When you're grieving, the emotion comes in waves. When we are depressed, emotions are chronic. When we are grieving, there's a fluctuating ability to feel pleasure. And when we're depressed, there's an inability, or it's very difficult to feel pleasure. When we are grieving, the closeness of others is reassuring. And when we are depressed, people tend to prefer to isolate. When we are grieving, our self-esteem is pretty stable. And when we are depressed, there is a loss of self-esteem and worthiness. When we are grieving, there is some guilt, and when we are depressed, there is guilt out of proportion. So as we are going through difficult times during our diagnosis, or just in general with life stressors, if you feel as though you're feeling depressed, that may be possible, but sometimes there's grief involved. Even during this COVID-19 pandemic that we are a part of, there's a lot of grief. There's a loss in the way we relate to people. There's a loss in how we're interacting with friends and relatives, and there's some grief involved with that. Not having human contact can create a lot of grief. So just keep that in mind when you think, oh, I think I'm depressed. It could be grief that you're going through. So what can chronic stress do? The long-term activation of any kind of a stress response will disrupt your body processes and increase the risk for. So if you're dealing with long-term chronic stress, you're at higher risk for anxiety, depression, we just talked about depression, digestive problems, headaches, heart disease, sleep problems, weight gain, memory and concentration impairment. So when you think about times when you've had some of these factors, you can think, well, I was going through a lot of stress at that time, or I'm still going through stress at this time. How does this affect you and your cancer? Overall, studies have shown that stress has not been clearly shown to worsen the course of disease in patients with cancer, but there's no question that reducing stress can help you cope more effectively when you have a cancer diagnosis. Next, we're going to talk a little bit about emotions and fear of reoccurrence. So once you've completed your treatment, it can be very stressful, but also very exciting. Because once treatment is over, a lot of the thoughts and feelings that you don't expect to have, you have. Your routine has changed. You're trying to get back to normal. The question becomes, what is normal? Where do you fit in your life? A lot of emotions get put on hold when you're diagnosed and you're going through a cancer diagnosis. And a lot of times you're just trying to survive, process the information, get through your treatment, and then once treatment is over, the emotions kind of flood in. There's also that fear of reoccurrence when you've completed your treatment. The what ifs that go along with that can be paralyzing, and that can impact your ability to sleep, eat, concentrate, make decisions, communicate, and just want to kind of couch this talk with, there are going to be emotions of fears when you're in treatment, when you have a fear of reoccurrence, when you're done treatment, and the fear of reoccurrence is normal. And those fears can be managed with some tools that I'm going to be providing. So what can you do about stress? We can remove the stress, or we can manage the stress. And as you know, some stress cannot be removed, and we just have to manage it. And we're going to talk a little bit more about that. We're going to talk about some automatic negative thoughts that happen to all of us. Whether you have cancer or you don't have cancer, every human being on this planet has automatic negative thoughts, and that's part of the human experience. But what makes us different is how we manage those thoughts. Human beings tend to have all or nothing thinking. They can overgeneralize. They can have a mental filter. We kind of disqualify the positive. In our heads, when you think about it, if you're just watching yourself, watching your thoughts, we all have thoughts where we personalize situations, we use should statements, we have maladaptive thinking. An example of that would be, I must be loved by everyone to feel worthy. That's a maladaptive thought. Sometimes we catastrophize, and sometimes we jump to conclusions. That's called the mind reading and fortune teller error. The thoughts that we have can be very powerful, and we tend to get into a habit and condition to think a certain way. It's very hard to change those automatic negative thoughts. And I'm suggesting to you that you start changing these automatic negative thoughts during or after a cancer diagnosis, and during a pandemic. It can be done, and this is actually the opportune time to do so. And the way that we can manage our automatic negative thoughts is using something called cognitive behavioral therapy. Any of you that have been in private therapy may be familiar with this concept. And if you want to go online and read about it, it's one of the underlying foundations of all therapy with therapists. Cognitive behavioral therapy is based on the idea that our thoughts cause our feelings and behaviors. Oh, did I miss that slide? Okay. Not external things like people, situation, or events. So our thoughts are the cause of our feelings and behaviors. So how we think is what causes us to feel a certain way and to behave a certain way. It's really not people, situation, and events, but we allow people, situation, events to influence our thoughts. The benefit of this idea and this fact is that we can change the way we think in order to feel, act better, and even if the situation does not change. So those of us that have a serious diagnosis, that have cancer, that situation is not going to change. But how we think about that is something that we can change. This is evidence-based. So I'm going to go through a scenario and imagine that you and I are scientists, and this is going to be an experiment. So this is a situation, and I'm sure you've all had situations like this. You've had a bad day, you're feeling frustrated, and this is pre-COVID-19. You're frustrated and you decide to go shopping. As you're walking in the mall, someone you know walks by and apparently ignores you. This starts a cascade of thoughts. The first thought that you're going to have is, oh my goodness, he or she ignored me. The emotional feeling that comes after that is that you might feel low, sad, or rejected. The physical feeling that accompanies that is stomach cramps, low energy, feeling sick. The action is that you might go home and avoid that person. And just avoid them and just kind of retreat. So that's an unhelpful thought that leads to very unhelpful reactions. Let's take the same scenario. A helpful thought would be, oh, he looks a little bit wrapped up in themselves. I wonder if they're okay. You see the difference in the thought. The first thought is, oh, he or she ignored me. That sounds very victim-like. When you say something like, you think something like, oh, he looks a little bit distracted. I hope they're okay. You see the difference in even how that sounds. One sounds very powerful, and the other sounds more victim-like. The emotion that you feel at that point is the concern for the other person. That's a positive feeling, not an unhelpful negative feeling. The physical feeling is the same feeling that you were feeling. Physical feelings are the same as before you saw this person. You get in touch with that person when you go home and to find out if they're okay, and they say, oh, I was on my way to a meeting, I didn't even see you. But what happened is the unhelpful thoughts resulted in some of the catastrophic thinking, that maladaptive thinking, that fortune-telling thinking, where we think something that isn't real. So I'm going to go next to replacing negative thoughts. So these are some thoughts that some people have when they're going through a cancer diagnosis. And you may relate to some of these thoughts. The first thought is, I should get better. A replacement thought would be, I wish I would be better. Do you see the difference? It's just the language. So even the language in your thoughts can definitively change the way you feel. I'm failing. Replace that with, I'm not doing the things I used to do. I had a patient once during a session that was so upset that she was only walking 2 miles a day instead of 5 miles a day after a long period of cancer treatment. And as she was telling me this about how she thought she was failing and she was so mad at herself, I just immediately said, stop. Listen to what you're saying. You're not failing. And we talked about it in the context of what I'm talking about with you today. Another thought could be, I'm not a good mother. A replacement thought would be, I love my children and I'm doing the best that I can. The negative thoughts really put you in a place of being a victim as rather than someone who's owning your story. When will I get better? Replacement thought, my goal is to get through the day. I'm doing my best. Why do bad things always happen to me? My journey is my story, and I own it. So think about it. Think about some thoughts that you have that are unhelpful or negative and how you can replace them. This is all very individual, but these are just some examples for you all. So I think a good exercise to help with this is if you could write down your thoughts and then challenge them. The important thing to remember is that your thoughts are not facts. People's words or things that you hear about yourself, those are not facts. If you are interacting with someone who's probably not the best person for you to be interacting with, and they're saying things, those are not facts. Those are people's words, and your thoughts are not facts. So you just got to keep in mind that you have control over your thoughts. You can't control what other people say. You can't control what other people do. You can't control situations, but you can absolutely 100% control your thoughts. So now we're going to go into the 4 A's. Hold on. I think we moved over a little bit too far. Hold on. Sorry, I've lost my, I think things have got moved around. Sorry. We want to go into the 4 A's. Give me 1 second. Sorry about that, everybody. Okay, there we go. 4 A's. Here we go. There's 4 A's. We want to avoid unnecessary stress. Learn to say no. Avoid people who cause you stress. So if there are people in your world that have behaviors or language that cause you stress, you want to avoid those people. Take control of your environment. Pare down your to-do list. If we could give people as much grace, give ourselves as much grace as we give other people, we would do a lot better when we're going through a cancer diagnosis. I tell people that all the time. You know, if you told someone what you were going through, they would say to you, oh my God, you're amazing, you're doing such a great job. We don't say those things to ourselves, and we need to start saying those things to ourselves. And we need to pare down our to-do list. Alter the situation. So you need to express your feelings when you're feeling them instead of bottling them up. Be willing to compromise and try to create a balanced schedule. The other thing that we can do is adapt to the stressor. We want to reframe the problem, and changing the negative thoughts to the helpful thoughts, that's reframing the problem. Look at the big picture, adjust your standards, practice gratitude, and practice self-love. Those are very, very important. Accept what you can't change. Don't try to control the uncontrollable, because that doesn't work for anyone, no matter how smart you are. Look for the upside or the silver linings, learn to forgive, and share your feelings. Okay, I'm just going to look. Okay. Other ways to manage stress. Self-care is very, very important. Time management, learning to manage your time better, setting priorities, setting goals for the day, delegating tasks, communicating, taking care of yourself through healthy diet and nutrition, exercise, walking, yoga. I know some of these things are a challenge during this time, but again, adapting to being at home more, because as I'm guessing that many of you are home more at this time. Meditation or prayer, humor, getting a massage, social activities, again, which are limited during this time, but this is temporary. I'm going to talk about wholehearted living. I don't know if any of you are familiar with a writer, a social worker. Her name is Brene Brown, and she studied resilience, shame, and how people live wholeheartedly. And she interviewed hundreds and hundreds of people, and she came to some very groundbreaking conclusions. And this is what she came up with through her research, years of research doing her doctorate. All the people who have a sense of worthiness and a sense of belonging believe that they are worthy of love and belonging. So again, it's a belief and a thought. So all of the stress management that we've talked about, replacing your thoughts, managing your time, that's all very helpful. But unless you believe that you're worthy of love and belonging, it's going to be hard to change those thoughts. And once you feel like you belong and that you're worthy, it's easier to change your thinking. People who live wholehearted, have a sense of worthiness, have 4 things in common. First, they have the courage to tell the story of who they are. They live with compassion. They're kind to others, and most importantly, kind to yourself. Very, very important to all of you. Connection. Let go of what they should be as a result of authenticity. So if you can let go of what you should be, then you can easier change those thoughts that we talked about that are not helpful. I should be a better mother. I should be doing this many more things. The tasks and the pressures that we put on ourselves can be rethought if we feel we are worthy. It makes it much easier. And people that live wholeheartedly fully embrace vulnerability. What makes them vulnerable makes them beautiful. So going through a cancer diagnosis, we have to be very vulnerable. Our bodies change, our self-image changes, our life changes dramatically, our physical health changes, and all of those things make you beautiful. It's necessary for life. It's not comfortable, but it's not excruciating. So if vulnerability can be not comfortable, but not be excruciating, then you're fully able to embrace it. Related to that study, the 4 things that people practice to live life to the fullest in her research, Brene Brown's research, is people let themselves be seen. They live with whole hearts. They love with whole hearts. They practice gratitude and joy, and they believe that they are enough. This is the key and the most important. Each and every one of you need to believe that you are enough. You are enough. So related to that, Brene Brown has a manifesto of the brave and brokenhearted. And I'm going to read that to you all, and it's on your screen. Manifesto of the brave and brokenhearted. There is no greater threat to the critics and cynics and fearmongers than those of us who are willing to fall because we have learned how to rise. With skinned knees and bruised hearts, we choose owning our stories of struggle, over hiding, over hustling, over pretending. When we deny our stories, they define us. When we run from struggle, we are never free. So we turn towards the truth and look it in the eye. We will not be characters in our stories, not villains, not victims, not even heroes. We are the authors of our lives. We write our own daring endings. We also write our thoughts, and that's how we manage our anxiety and our stress. We craft love from heartbreak, compassion from shame, grace from disappointment, courage from failure. Showing up is our power. Story is our way home. Truth is our song. We are the brave and brokenhearted. We are rising strong. Okay. So we're gonna end this with me showing you some meditation apps that you can download on your phones. There's one called Aura, one called Headspace, one called Breathe, one called Buddhify, one called Palm. So if we're gonna sample, we're gonna do about a 4-minute meditation. I don't have any music to stream with this, but if you have any music handy at home, you could put on some relaxing music. And in about 10 seconds, I'm gonna ask everyone to find a place where they're sitting, and I want you to sit comfortably and we're going to do a little mini relaxation exercise. Okay, we'll begin. So I want you to choose a word like calm, let go, or relax, and I want you to associate that word with what we're about to do right now with this relaxation exercise. And when you do it in the future, I want you to have this as a trigger word. I'm gonna be calm, I'm gonna let go, I'm gonna relax. And that word is something that you can associate with relaxing. Even if you don't go through a formal relaxation technique like this, anytime you need to relax, and that could be to do deep breathing or anything that is helpful to you. So we will begin. Sit comfortably and allow your hands to lay gently on your lap or at your sides and relax comfortably. Remember, keep your lips closed, your jaw relaxed, and breathe slow and low. While we are doing the mini relaxation, I want you to say the word relax to yourself. It's important that you are breathing from your stomach more so than from your chest. Now I'd like you to focus on your feet. Notice any pressure or discomfort in your feet and relax that feeling. Notice the soothing warmth in your feet. Relax. Feel the release of pressure. Slowly let your attention move from your calves to the areas around your knees. So we're moving up. Try to focus on the tension in those areas, noting feelings of pressure and replacing them with feelings of calmness and warmth. Relax and feel the release of the pressure from your calves up to your knees. Remember to keep breathing and relax. Continue to move up your body and focus the feelings in your thighs and noticing any pressure. Focus on your thighs and relax the tension. Now I want you to focus on your abdomen and the tension in your chest. Focus on your abdomen and the tension in your chest. Feel your body relaxing, the tension, and I want you to breathe. Next, feel the tension in your neck, in your shoulders, and in your head. Feel the tension and then release. Now we're going to move to your arms and your hands, and we're going to focus on the tension in your shoulders, your arms, and your hands. Keep breathing. Release the tension in your shoulders, your arms, and your hands. I want you to notice the difference between the sense of relaxation as compared to your previous feelings of tension. So we've relaxed from our feet all the way up to our shoulders, down to our elbows, down to our hands. I want you to take a few seconds to breathe in and 3 seconds on the breath out. Breathe in, breathe out. And remember to say the word relax when you're breathing out. Let's do it a couple more times. Breathe in, breathe out. Breathe in, breathe out. So take a couple of seconds to just relax and then open your eyes. So we're done with the relaxation technique, and now we are going to be open for questions. So any questions that you have, you'll be submitting, and I will answer the questions. And thank you so much.